let me tell you the game in surgery, and I'm been no different than all the other surgeons in the world, basically, but surgeons run a race, essentially. We essentially imagine ourselves of getting on the hamster wheel, and we run as hard as we can for as long as we can doing procedures, because that's how we help people. That's how we earn our income. It's a volume-based industry. And several years ago, the primary care doctors started doing a concierge style practice where they said, look, I can't make it based on the insurance companies and Medicare's reimbursement, so I'm going to look for an alternative model. And so what they did is they figured out how many patients they needed to keep the lights on and what they would need from those patients. And they said, okay, I'm going to open a shop up. I'm going to limit my practice to X number of patients, 300, 400, 500, whatever it is. They will all pay a premium, but for that, they will have me at the availability, and my practice will be limited so that as soon as they need me, I'm on call for them. I'm ready. Surgeons, by and large, have no such model to go with. But I'm an out-of-the-box thinker, and I'm just kind of thinking about how we run as surgeons and how many cases does a surgeon need to do a year to maintain proficiency, so there's a minimum there, and how many do they need to do from a maximum standpoint where they're running too hard, they're too tired, too many cases, patients get lost in the mix. Let's say, and I'm on schedule to do around 800 surgeries this year. Do you really want to be case 799 of 800? And if I'm the patient, I don't think so. I'm going to embrace the surgeon that's sort of self-limiting to maintain the quality and do the best that they can possibly do for me and my particular outcome. So I'm going to take a bold step this year, and I'm going to consciously limit my practice and limit the number of surgeries. And for me, that sort of magic number is around 520 cases. That's what I did for 15 years. It's enough that I maintain proficiency and I'm good at what I do, but it's not overwhelming. And so that's what I'm going to try to do. And with the concierge pathways, I can do that. So what I'm going to do is I'm going to figure out from each level or tier how many of those surgeries I need to fill for this particular year to get to a total number of 520, and then I will set up an algorithm that backfills each one of those, and that way I'm going to be at my best for you. Now let's say you're targeting a lower tier and that tier is not available. Well, there are two options. One is you can move up a tier if there are still spots in that tier available and schedule into those slots, or unfortunately, I can help you find another physician to do the surgery. And that's hard, but we're talking about joint replacement. We're talking about piece of your body that's going to be with you every minute, every second, every hour for the rest of your life. What can be more important than that? Like we talk about how a car is important and we're willing to go and get this particular car or this particular plumber, but we're talking about something that's going to be with you every second. I'm not sure that there's a better investment into your own body and your own health. So for me, I'm going to take a big leap this next year. I'm going to trust in my patients that they're going to believe in me and believe the vision that I have of wanting to maintain the best possible result for them, best possible care that I can deliver. And the only way I can do that and still keep the lights on in this beautiful little office is by limiting but expanding the concierge pathways. So I hope you agree with that. Let me know what you think.